An inguinal hernia is a protrusion of parietal peritoneum and abdominal viscera, such as a loop of intestine or greater omentum, through a weakness in the inguinal region of the anterior abdominal wall. Inguinal hernias are more common in males because the inguinal canal and superficial inguinal rings are larger than in females to facilitate the passage of the spermatic cord through the inguinal canal. There are two types of inguinal hernias, direct and indirect. More than 2/3 are indirect. Direct inguinal hernias are acquired, often resulting from excessive intra-abdominal pressures while straining. Pass medial to the inferior epigastric vessels through the inguinal triangle, a relatively weak region between the inferior epigastric vessels, rectus abdominis, and the inguinal ligament. Are contained within a hernial sac, covered by peritoneum and transversalis fascia. Usually traverse only the medial third of the inguinal canal. Exit the inguinal canal through the superficial inguinal ring, outside of and lateral to the spermatic cord, and rarely enter the scrotum. Conversely, indirect inguinal hernias are congenital and more common. Pass lateral to the inferior epigastric vessels through the deep inguinal ring. Are contained within a hernial sac, covered by the peritoneum of a persistent processus vaginalis and all three fascial coverings of the spermatic cord. Pass through the inguinal canal. Exit the inguinal canal through the superficial inguinal ring, inside and often anterior or medial to the spermatic cord, and commonly enter the scrotum or labium majus. Palpation of the inguinal region allows the examiner to diagnose a hernia and also to distinguish between the different types. The superficial inguinal ring is palpable supralateral to the pubic tubercle, and the presence of a hernia may be detected by asking the patient to cough, causing the hernia to protrude while palpating the ring. This establishes the presence of a hernia, but does not distinguish the type, because both types exit the superficial inguinal ring. To distinguish the type of hernia, the deep inguinal ring and inguinal triangle should be examined. The deep inguinal ring can be found superior to the inguinal ligament, 2 to 4 centimeters superolateral to the pubic tubercle. A protrusion here indicates an indirect inguinal hernia. To diagnose a direct inguinal hernia, the examiner assesses the inguinal triangle medial to the deep inguinal ring. A protrusion here is indicative of a direct inguinal hernia. Both direct and indirect inguinal hernias are treated by surgically returning the herniating mass, viscera or omentum, to the abdominal cavity and reducing the dimensions of the canal and/or inguinal rings, often overlaying the internal inguinal ring or inguinal triangle with a reinforcing synthetic mesh to prevent future herniation.